Most sexually active people will get HPV sometime in their lifetime. It's just a matter of whether or not it advances. HPV is the most common sexually transmitted disease, which can lead to genital warts, abnormal cancer cells, which often lead to cervical cancer, oral cancer, or anal cancer, and there are over 100 types of HPV. Anyone who has sex without protection is at risk for getting HPV.
LR HPV is low risk HPV, and these are the types of HPV that cause genital warts or other types of warts all over the body. And then the high risk HPV or HR HPV, those are the ones that can cause different types of HPV cancers. So primarily people think of cervical cancer when they think of HPV, but there are other types of cancers that both men and women can get from HPV. Testing varies based off of the individual's age, again, and there's only FDA-approved testing for women at this time. So it's really important that women go and have their well women's exams and be tested for HPV. The current vaccine that's available in the US is called Gardasil 9, and so that protects against 9 different types of HPV. So 7 that can cause different types of HPV cancers in both men and women, and 2 that cause a majority of genital warts. With that vaccine, it was again primarily studied in the general population, and some of those types are not that prevalent in these Native communities we worked with.
But we do know that Native women as well as Latinas here in Arizona are disproportionately impacted by not only HPV but cervical cancer. And that's why we want to better understand these women.
There's technically not a treatment. There are treatments to treat it when it does flare up or when it is active. And so, again, stressing the importance of the vaccination because there is no treatment for HPV.
The vaccine itself is made of what are called virus-like particles, meaning they're like a virus. So they look like a virus, they trick your body into thinking you have a virus, but they're actually not a virus and they're not actually infectious to the individual.
Because we still have this health disparity despite really high vaccination rates, including on the reservation. Some communities have the highest vaccine rates, but they still suffer from cervical cancer. So what's the disconnect? That's what we're trying to better explore through our project and other projects with Dr. Lee.
No one should have to suffer cervical cancer. It's one of the few cancers we can prevent. So we're working on this great project. It's kind of 2 parts. One, we're doing data collection to understand how the vaginal microbiome is interacting with HPV, specifically in Native communities. The other part of this project is promoting education. So getting the word out about what's actually going on through social media outreach programs, as well as different types of education material.
The goal of the project is to decrease HPV among Native Americans and HPV persistence that can lead to cervical cancer.
Without research, we wouldn't know which medicines work for us better than others. Without research, we wouldn't have community grants where we can have awesome conferences or take our kids to Head Start program. We need to find out what really works for us. So this study is another opportunity for women also to participate with only women, right? And women that look like them and sound like them.
There's multiple steps that take place, and I think one of the key things now that many researchers are learning, whether they're Native or not Native, is partnering with the right research groups such as MedStar, and that's one of the reasons why we wanted to reach out to MedStar, because they had such strong ties with Native communities. It's really important for them to have the strong community ties, because you just can't walk into any community and want to do research. I think too many people know nowadays that's not how it's done or shouldn't be done.
Research it's a long game that we're playing, but it's also like that's just like historically how science works, but also like our own Native storytelling and how any Native learning has been done. It's like always for the long game. It's always through storytelling. It's always through generational gain. We want our kids and our grandkids to do better and be better and grow up in a world better than the one that we did. I think a lot of like our elders remember that these are important moments because we are also supporting each other. It is a cycle, a long cycle, but it is a cycle that gives back.
The more they know about what's impacting their bodies, the more they can put themselves in the driver's seat and make the decision to have their health at the level they deserve.
Most Native women don't want to go to the doctor every year. There was a woman that said her youngest son was 7 and she hadn't been to the doctor for 6 years because she was fine. She felt healthy. And sure enough, she participated in one of our other studies, and when some things came back to show that she was having some protein leaking in her urine, I suggested that she go to do a women's check. And sure enough, she had a tumor inside of her uterus. So not only are we doing research, we also have this opportunity to be good, decent human beings. So if something were to come back, we give up-to-the-minute feedback. We're able to give suggestions if we ask permission and people want the suggestion. So my suggestion is always, once a year, go to the doctor. If you're healthy, great. Listen to what the doctor suggests to you, not only for just you, your whole family.
I think now the idea of being involved in clinical trials, hopefully Native communities are being more open to the idea. And a lot of that, I think, is researchers such as myself, other Native Indigenous researchers are being involved with these clinical trials, involved with the research. And so we're trying to build that trust back with these different communities because we know it's been broken in the past. And so doing it in a respectful manner in the right way and partnering with the right groups such as MedStar.
If we want to make sure that we're part of our future generations and be good help for the next 7 generations, it's important that we do our part. Step up, go to the doctor, get our yearly exams, but also, why not participate? You get compensated for your time. You get to come eat with us and hang out with us. But it's a good investment for yourself and for your family.